The following presentation describes an original technique for reconstruction of the anterolateral ligament under arthroscopy. This was a cadaveric feasibility study. For this technique, we used a fascia lata strip, which is not dissected distal to the lateral epicondyle, to allow for a wide distribution of rotational control and better isometry. The lateral epicondyle is first identified, and an intraosseous needle is placed slightly posterior and proximal to it on the isometric point. 3 endoscopic portals are identified: a classical anterolateral portal, the epicondylar portal, previously identified with a needle placed under ultrasound control, and a proximal portal 5 centimeters proximal to the axis of the thigh. Subcutaneous tunnelization from anterolateral to proximal portals is performed. The scope is introduced through the proximal portal, and a working chamber is created using the shaver introduced through the anterolateral portal. The needle is easily identified and serves as a landmark or reference point. A pair of fine pointed scissors is introduced through the anterolateral portal. Longitudinal sections of the fascia lata are made on either side of the needle. The strip is dissected off the deep plane. The 2 portals are exchanged, allowing the proximal release of the strip. The epicondylar portal is established around the needle, and a retrieval forceps allows the externalization of the strip. The strip is reinforced with a fiber loop whip stitch and then calibrated. A beath pin is introduced on the isometric point and is drilled through to the anteromedial side of the thigh, immediately proximal to the top of the patella. A tunnel is reamed, allowing the introduction of the strip. Fixation is achieved with the knee bent at 30 degrees in neutral rotation using an interference screw. Dissection is then performed to analyze the strip and its tension in internal rotation.